Finally, vitamin K part 5, some of the other FAQs that came up. Once again, Sarah Wickham, vitamin K for your newborn, evidence-based birth, vitamin K for your newborn. Fantastic resources of evidence-based information that really goes through all of the research that we've got, all the answers to your questions in depth. So the next question that was coming up quite a lot is if I have a home birth and have a straightforward birth, or if I just have a straightforward vaginal birth, no interventions, no forceps, no ventouses, there's no induction, etc., then surely that reduces the chance of vitamin K deficiency bleeding. And from a physiological perspective as a midwife, it makes sense that if you've had something like a forceps or a ventouse, surely that would have an impact on an increased chance of vitamin K deficiency bleeding. But there is no evidence of this, and the research really highlights that vitamin K deficiency bleeding doesn't actually discriminate by the type of birth you have. Now, if we go back to where researchers were starting to look at this in the 1800s and then the 1940s and 50s, for example, the most common form of birth at that stage was spontaneous vaginal, no induction, no caesarean birth. Forceps was starting to increase around sort of the 40s and 50s in use in some places, but primarily birth often did not happen in hospitals with interventions. It was still hands-off births. And so the rates of vitamin K deficiency bleeding were just as high with spontaneous vaginal births than anything else. And all the research since highlights no difference between those who have caesarean births, instrumental births or vaginal births. And the cases which you can go and read on evidence-based birth highlight that they were all from low-risk background settings and all from midwifery-led birth centres where there wouldn't have been ventouses, there wouldn't have been inductions or forceps, for example. So they were all from spontaneous vaginal births. The next one that popped up a few times was that it wasn't a vitamin and that we shouldn't be calling it a vitamin because it's called phytomeniadone. Now, like with most things have got a chemical component or a chemical name. For example, dihydrogen monoxide is water, for example. Iron is ferrous. It all has something to do with the chemical compounds in chemistry. Almost every vitamin that is out there has a chemical name because it's to do with the elements in terms of the molecular structure that happens. And phytomeniadone is vitamin K1. Whether it's naturally produced or whether it's a synthetic version, it is the same structure. Now, this led on to some of the excipients. It doesn't contain aluminium. Canakion here, you can go to the British National Formulary, so the BNF, it's available, you can freely search for it. Canakion doesn't contain this. The list of excipients are there. It doesn't contain mercury, and contrary to this wellness influencer, it doesn't contain polysorbital 80 either. This is a great time though to really highlight that you can ask for the inserts of anything that you want to have a read of. Highly recommend that you do. I wouldn't want anyone going into having anything within their pregnancy, birth, parenting, or life in general without having a look at the risks and the benefits, having a look at the pamphlet and being able to read these things yourself. You should be fully informed and feel comfortable with whatever choice you are going to make. You can ask your midwife for the insert in whatever it is that is out there. Neo-K is another option that is available here as well as an alternative. And again, ask for the pamphlet, but they are also available online to be able to go and have a look at in the antenatal period. Now, another aspect to look at is about breastfeeding and breast milk and why does it contain low vitamin K levels, but also how can we increase vitamin K levels in breast milk and is it possible? And surely that could be a substitute for the vitamin K prophylaxis, either injection or drops, for example. Now, there has been some research in this particular area, and what they found is that vitamin K levels with high supplementation doses in the mum can sometimes increase in the breast milk. But they have only taken place on women and babies where babies had the vitamin K injection or the oral drops. They had never taken place, these research studies, in babies who had not had vitamin K from birth. So we don't know what the long-term impacts, what the benefits could or couldn't be. And the problem is we are so far down the line now that it would be unethical to randomise babies into either having or not having, because the consequences of not having, if they are one of those babies who sadly have vitamin K deficiency bleeding, could be massive. So the reason why these studies have taken place on babies who have already had vitamin K is because it's unethical to randomise babies into yes or no vitamin K at this stage. Amongst the abuse and threats was the black box aspect. We don't have that here in the UK. Go and check out part 3 for that. If you're in the United States, there is a specific black box FAQ on evidence-based birth vitamin K. Go and have a read of it. Go and see what it says. Was the link that was made between giving the injection of vitamin K and leukemia back in 1992 and 1998. And it's an incredibly understandable concern. So let's look at those 2 research studies and look at all of the other research studies. The problem is these individuals were cherry picking 2 different studies, yet overall and across all of the different studies, and the most recent ones in 2002 and 2003, which are the best quality evidence that we have got, highlight no association. And in 1999, the World Health Organization actually put a statement that there is no convincing evidence to say that there is a link between the intramuscular version of vitamin K and developing leukemia in childhood. But let's take a look at these studies, and again, Evidence-Based Birth, Sarah Wickham, they're all there, and you can go and search for these. Most of them are open access that you can read them yourself. So this was the 1992 study that found a correlation between giving intramuscular vitamin K and having had childhood cancer. Remember, we can't do randomised controlled trials because we would have to pull back the vitamin K itself, so it's unethical to do that at this stage. So all we've got is cohort studies looking at data itself. And within this, 195 children who had cancer who were diagnosed between 1971 and 1991, but born in 2 Bristol hospitals between 1965 and 1987, were compared to 558 children who did not have cancer. And what they found is that babies who were given intramuscular vitamin K from the records that they were looking back on had a higher chance of developing childhood cancer when compared to having no vitamin K or oral vitamin K. And so this changed a lot of practice and a lot of recommendations after 1992 here in the UK, and lots more people started to choose the oral version, which is still an option for people to choose from. Now, there was one more study that found a link between neonatal vitamin K being given as an injection and a particular type of childhood cancer. Now, this study looked at 685 children who were born and lived in the north of England who developed cancer before their 15th birthday, and they compared it to 3,442 people who were born between 1960 and 1991 who were matched for their date and hospital of birth. Now, compared to the 1992 study, they found that there was no association between giving vitamin K as an injection and the development of all childhood cancers. They also found no difference for acute lymphoblastic leukemia overall. But what they did find was an increased chance of developing acute lymphoblastic leukemia between 1 and 6 years after birth when the vitamin K injection was given. And in comparison, when no vitamin K was given, or alternatively the oral version was given, there was no increase found in developing acute lymphoblastic leukemia between 1 and 6 years after birth. Now, in contrast, there were 8 studies between 1993 and 1998 that found no statistically significant associations between giving the injection of vitamin K and developing childhood cancers. And some of these, unlike the 1992 and the 1998 studies, were huge studies. This one looked at 1.3 million full-term births after non-instrumental births. And this was from all maternity hospitals in Sweden. Another study that highlights that there's no association with childhood leukemia and the administration of vitamin K. A study highlighting that there's no association between intramuscular vitamin K and leukemia. Another study, no difference. And you can freely search for any of those different ones and have a read of the studies yourselves. Now, the two that we go with as midwives, as paediatricians, as doctors across the world, because it is recommended by the World Health Organization, the Department of Health, and so many other institutions and bodies of healthcare to have vitamin K at birth, we go from the latest 2 studies that are of the best quality evidence. And this one in 2002 looked at 6 case control studies that were conducted in both the UK and Germany, and it comprised of 2,431 cases of children with cancer diagnosed before 15 years old, and then compared it to 6,338 control children. And from this large study, they found that there was no convincing evidence that intramuscular vitamin K is associated with childhood leukemia. And then we have a further study published in 2003, and they looked at 1,174 children who had leukemia and compared it to 4,487 children who did not have cancer. Overall, 39% of cases and 42% of controls had injection of vitamin K. Now, based on this particular study, which is one of the most recent and the most current, they found no convincing evidence either that neonatal vitamin K administration, regardless of which route it was given, influences the risk of children developing leukemia or any other cancer. And there is one other theory about why these effects may have been seen in these 2 studies. Now, the previous preparations in the 60s, 70s, 80s, 90s was that it contained something called phenol, because there was a potential tumorigenic capacity in animal studies. Kanakian and Neo-K, which are the licensed preparations here in the UK, contain none of this. You can freely search for this. It's also in part 1 of Vitamin K series. Now, sadly, there's been no study since 2003 to explore this theory further. Based on the highest quality evidence, the most recent evidence, we have no link between the injection of vitamin K being given at birth and the development of leukemia. And also, we have seen no link whatsoever between giving it orally and developing any childhood cancers in any of the research studies. Really interesting, because across the world there are variations in the doses that are given, the amount that is given in terms of vitamin K, but also what's really interesting is that they tend to be higher doses as well given orally of vitamin K in that postnatal period too. And both Evidence-Based Birth but also the Shearer publication in 2009 really go through the depth and the history about the links between vitamin K and childhood cancer. Again, highly recommend that you go and read and have a read of the background and what changed practice in the UK and then has come back full circle again. Most hospital pamphlets, leaflets on vitamin K do even make reference to the 1992 and the 1988 study and make reference to all of the other studies looking at massive quantities of children globally at different hospitals, in different settings, in different countries, and they've looked at all of that to highlight that there is no link. Now, does that mean to say that there won't be a link in the future? Who knows? It depends on who's researching and when. But here in 2026, there are no associations between vitamin K being given as an injection after birth and developing childhood cancer. As with anything in life, there are benefits, risks, there are alternatives. It's about listening to your instinct, knowing the ins and outs of what your choices are with every scenario possible. And as always check your sources, always check your resources. There is so many different publications on vitamin K that are evidence-based. Evidence-Based Birth, Sarah Wickham Vitamin K. Please have a read of them. They are fantastic and they have no misinformation in them at all. And whatever you decide, you should be supported in your choices.